Fibromyalgia is a common chronic pain condition that has left patients and providers shrouded in confusion and frustration for decades. This is partly due to the lack of understanding of the cause of the disorder itself, as well as the ambiguous diagnostic criteria that is utilized in clinical practice, resulting in disagreement in the scientific and medical community on how best to manage these patients. This has stemmed the so-called fibromyalgia wars, with patients unfortunately caught in the crossfire. In this video, we will highlight the misconceptions that have plagued the disorder and discuss what patients and providers can do to arrive at a proper diagnosis. Over the past 30 years, there's been a dramatic rise in research studies investigating fibromyalgia, which has brought much needed guidance in the diagnosis and management. This increase in awareness has also helped to legitimize fibromyalgia as an actual disorder, as for quite some time its existence was called into question based on a lack of understanding of a clear cause. But even with these advances, there continues to be disagreement as to how this disorder should be classified and how best to identify individuals with the condition. Besides the use of blood tests to rule out other diseases that can mimic fibromyalgia symptoms, there continues to be a lack of valid and reliable means of arriving at a diagnosis. So why is diagnosing fibromyalgia so challenging? Well, unlike many other medical conditions that have a clear set of unique characteristics, fibromyalgia is a bit of a mixed bag. Symptoms can exist on a continuum, which can significantly blur the boundaries between someone with fibromyalgia and someone without, and has become a bit of a medical chicken or the egg situation. For example, depression is a common feature in those with fibromyalgia, being estimated to be found in 40 to 80% of patients, and is thought to be a major contributor, and can explain the physical symptoms in the absence of physical injury or active disease. However, it is important to note that not every patient with fibromyalgia is depressed, and not every patient with depression reports chronic widespread pain. Additionally, poor sleep quality and fatigue are other hallmark features of the disorder, but it is unknown if those with fibromyalgia have poor sleep quality due to their pain and depressive symptoms, or if the depression and pain is a direct result of inadequate sleep. So when it comes down to it, we still do not fully understand if the combination of these symptoms is just the consequence of the chronic pain condition, or whether they are unique to the disorder itself. Due to the variability of these symptoms, researchers attempted to get more objective with their clinical testing through what is called tender point examination. This test consists of the examiner pressing on 18 different spots on the body to assess pain response. But inconsistencies and lack of reliability was seen in this test, and it is no longer suggested to be used in clinical practice. Unfortunately, the decades of using this clinical test have created the perception that fibromyalgia mostly affects women. When estimating the prevalence of the condition, including the tender point examination, the female to male ratio was believed to be 10 to 1. However, more recent epidemiology studies that took out the tender point examination show ratios closer to 2 to 1. This has led to large proportions of providers neglecting to consider this diagnosis when a man presents with chronic widespread pain, and has created a stigma around fibromyalgia as primarily a female condition. In place of the tender point examination, the American College of Rheumatology suggests the use of the Widespread Pain Index instead. This clinical questionnaire considers not only pain, but also other common features of fibromyalgia, including fatigue, sleep quality, as well as mental health, and is believed to be a more valid method to identify those with a diagnosis of fibromyalgia. I provided a link to the Widespread Pain Index in the description for reference. Because of the lack of valid and reliable clinical tests to diagnose fibromyalgia, patients are reliant on their provider's knowledge and expertise on the disorder to arrive at an accurate clinical diagnosis. The issue with this is that not all providers are informed about the condition due to the inconsistent medical training on the topic. This has resulted in fibromyalgia blind spots in clinics around the country, causing delays and inconsistencies in diagnosis. A large survey of individuals with fibromyalgia reported nearly half of the individuals visited between 3 to 6 healthcare providers before finally receiving a proper diagnosis, and in the meantime often received unnecessary tests and ineffective treatments. Another study estimated that nearly 75% of patients diagnosed with fibromyalgia did not actually meet the established criteria for the disorder. That same study found that only 27% of individuals who reported symptoms consistent with fibromyalgia have ever received a diagnosis. In summary, the clinical diagnosis of fibromyalgia can and should be made by the primary care physician using a thorough medical history, including the use of the Widespread Pain Index, as well as a physical examination and laboratory tests to rule out diseases that can mimic fibromyalgia. A referral to a specialist, including rheumatology, neurology, or endocrinology, should be limited to situations where there is a reasonable clinical suspicion of some other condition that is presenting similarly to fibromyalgia. Patients who have a suspicion that they have the disorder should seek a primary care provider who is experienced in the management of fibromyalgia, as not all providers have adequate training in its diagnosis and management, which can significantly impact the quality of care received. Research on fibromyalgia has come a long way, helping to legitimize the condition and has provided much-needed guidelines in its diagnosis and treatment. But it is clear that we have a ways to go in our understanding of the nature and management of the disorder. Well, I hope you enjoyed this episode of Physio Show. Make sure you like and subscribe to the channel to receive more physical therapy related content.